Alright everybody, welcome back. In this video we're going to be talking about the in-system lifts that we have, or the in-ceiling lifts that we have in the rooms. So right now I'm in the middle storage area, and on this wall is going to be where you have all of your supplies that you would need for the lifts. So we have two kinds. We have the repositioning sheet. These are the repositioning sheets that we have. They're in these two bins. There's no difference in size here. So if you're using this for, say, like a vented patient who is larger and you're going to use the lift, use these. And then you have your chair lifts. So there are different sizes for your chair lifts. So up top you have everything in green, that's a chair lift. And then these ones down here are also chair lifts. So we have three sizes. You have your medium, which is going to be your green with your yellow border. And if you don't know where the size is, it's right here where it says medium. The green with the blue border is your large. So again, you look here, it has your large on there. And then these white ones, these are your extra large. So you have your information right there. So if you need a lift, make sure that you scan them. And then over here, you're gonna have some straps that you could use if you're trying to lift, say, one of your patient's legs. Then you have your two sizes. You have your small, and then you have your large. So now we'll show you how to use the lift system and the chair lift. Alright y'all, welcome to this lift video. We're going to go ahead and get started and show you how to use your lift slider to adjust your patient and your bed. So we've already showed you where your supplies is going to be. So this is a one-size-fits-all sheet essentially. But the thing about this is that it will only go up to 500 pounds, correct? So if you have a patient who's bigger than that, you're going to have to MacGyver this. Your green is going to be facing down towards the bed, so on top of this you could put your pads. You could use this itself as a slider, but of course we're going to be utilizing it for our lift. So the biggest thing with the lift is you want to make sure that you don't slap your patient in the face with it. So the control itself, you should look at her, she's like, no. So you're going to bring it towards the center, and then you'll press the down button on your remotes. You want to remember also to hold the bar, because this can swing, so if you're bringing this down you will potentially hit your patient in the face. So come close, yes. The next thing is, once you have the bar down, is that you want to attach your green straps. Basically you want to do the same ones. So if I'm starting with the strap up here, we're not going to have the other person on the strap up at the bottom. So just connect all your straps. So now we have all of the straps connected. All we got to do now is lift the patient up. We're going to hold our bar. The patient will be lifting up. And now they're in their nice little cocoon. So once they're lifted up off, if you need to put your wedges under them, anything like that, if you need to change your sheet, you need to re-zero, do whatever you need to do. And then all you're going to do is, with the bar, kind of pull them up towards the head of the bed and then lower down. Again, whenever you're lowering them down, if you have any IV tubing or vent tubing, any feeding tube tubing, anything like that, you want to make sure that all of that is not coming out, and it's not kinking, and that it's not occluding or anything like that. Once we have our bar back down, then we can just take all the straps out and fix the patient's hair. Yes, of course. Something that's of importance with the lift is that you have your emergency stop. So if for any reason we need to stop, you just pull on that, and I cannot lift the bar up or down. So if you needed to stop it emergently, then you could do that. To resume it, then you would just push this back in. So now our patient is up in bed. And now we're just going to put this bar all the way to the top and move the lift out of the way. And that is how to use your slider. Now we're going to show you how to use your chair lift. Okay, so now we're going to practice using the chair lift. We've already shown you there's 3 sizes: medium, large, and extra large. On your packaging, it's going to tell you what the max weight limit is. So the chair lifts, essentially when you open them up, look like this. You're going to have your straps not on the patient's skin. So this area here will go to the patient's back. You can either roll your patient side to side, or you can sit your patient up and put the chair lift behind them, which is what we're going to do. Just because it seems like rolling your patient side to side is kind of obvious on how to do that. But essentially what we're going to do is have our patient sit up as much as possible. Again, just because you're using the lift, you still need to try and have 2 people. It's going to be a lot easier with 2. So, Dalton, go ahead and help me sit her over. She cannot help us with anything.
She's fighting against
We're gonna have her sit up. Stop fighting us. We're gonna put the lift behind her, and then she can lean back. So now we have our 2 straps here, and these are actually gonna go under the patient's legs. So we're gonna lift the patient. Oh my gosh, you really are doing good weight right now. And then what you're gonna do is you're gonna have these crossed. You're gonna bring your lift on over. I really hope you don't fall through the center. No, I'm just playing. You won't. Again, hold your bar.
I was gonna let Dalton do the chair right now.
You're like, maybe I shouldn't have volunteered.
That's why I got outside.
So we have these crossed. We're gonna put these in place. You have your laptop up here. Again, make sure that you're cautious of your tubing, of any kind of tubing, your patient's IVs, disconnect them from everything. You're monitoring all of that stuff. It should be easy to try and make it as easy for yourself to try and get the patient over to the chair. So now we're gonna go and lift up. You ready for this ride?
Yeah.
You're like, I'm not ready. I'm not ready. You're like, this is so weird. So now we're gonna lift
I'm
up.
like trying to do dead weight, but I'm afraid
I'm gonna
of
transfer
the
that
fall.
over to Dalton. I'm gonna come over to this side and basically bring this patient
I'm
over.
still kind of flexible, so I think we.
And then we want to make sure that this chair is properly positioned under the. All right,
And
I
it is
think you're
locked.
good. And that it is locked, correct?
As we just found out.
Right. So now this is down. We're gonna take off our straps. And then from here, we could essentially, both of us, just reposition the patient up. Do you want us to?
Well, I mean, I don't want to.
You're like, I mean, I'm not gonna do anything. So let's have her sit up. And then we're gonna lift back up 3. 1, 2, 3.
Hey.
There she is. We can keep this under the patient, or at this point, we could have the patient lean forward and pull it right out the back. And then ta-da! Our patient is in the chair. Cool. Okay guys, so that is how to utilize your chair lifts. We've gone through where to get your supplies, make sure that you charge it to the patient, and we've shown you how to use your slider lift system, and then we've shown you how to use your chair lift system. So always make sure that if you're using your lifts that you still try and have another person in there, hold that bar, know where your emergent stopper is, especially have that other person there if for some reason you're using it on a patient who you have multiple lines and all the cords, everything like that. Have that second person there to help you. It's going to go a lot quicker too. And so hope you enjoyed this video. I'll see you in the next one. Bye.